This is the MedStar Washington Hospital Center Cardiac Cath Lab Risk Calculator, produced by Eileen Searson and Dr. Hank Rappaport. It allows for a clinician to go to this secure website to insert clinical information on the patient in order to assess risk for mortality, post-procedure bleeding, 30-day readmission, and contrast-induced nephropathy. The algorithms in this risk calculator are based on articles by Brennan, 2013 JACC article on mortality risk, Rouse, 2013 JACC article on post-procedure bleeding risk, Wasfy's 2013 article in CIRC for 30-day readmission risk, and lastly, the 2004 Moran article in JACC for contrast-induced nephropathy. Once the clinician puts in the information on the patient, the risk scores will populate on the bottom as well as graphs above highlighting the values. It's important that the information is correctly inserted. This is information that the clinician should have in front of them, easily accessible anyway. Once the data is inserted, you will see graphs above that are color-coded. These are the raw scores below based on the article's algorithms. Above, you see 4 graphs, one for mortality, 30-day readmission, post-procedure bleeding, and contrast-induced nephropathy. These are color-coded based on showing values to the clinician as far as green meaning good or low risk, mortality risk being intermediate would be yellow, and red meaning high risk. As you can see with this particular example, this patient has medium to high risk for these levels. We believe that this resource helps with clinical decision making and believe that other hospitals can do similar programs for their patients to both test these algorithms as well as help with assessment for their particular patients.